Hi, and welcome to Let's Talk Housing. I'm your host, Sarah Goldvine from BC Housing. Today, we're going to have an interesting conversation with guests from BC and from Ottawa, exploring the common challenges and innovative solutions in social housing, learning from each other. Ottawa Community Housing recently introduced a complex care housing strategy, which aims to support tenants emerging from chronic homelessness, as well as those living with mental health, substance use, behavioral challenges, and health issues related to aging. We've got a lot of the same priorities here in BC. So we're going to discuss this strategy and its reception and really highlight what we can learn from each other and where our differences may be. I'm pleased to be joined today by co-host Heidi Hartman, Associate Vice President of Supportive Housing and Homelessness. Heidi is well known to many people here in BC Housing and across the sector. We're joined by guest Brian Gilligan, Chief Officer, Community and Tenant Support with Ottawa Community Housing, and by BC Housing's own Frank Tick, Coordinated Access and Assessment Manager. Before we get underway, I'd like to acknowledge that we're recording today's podcast on the unceded territories of the Musqueam, Squamish, and Tsleil-Waututh Nations here at BC Housing's home office. We do our business on the territories of hundreds of First Nations around British Columbia and extend our gratitude to their peoples past and present. Of course, today we are also joined by a guest from Ottawa who's traveled from the unceded territories of the Anishinaabe Algonquin, and we're really grateful to be able to draw on that knowledge as part of our conversation. For transparency, we're recording this podcast in November of 2024, and our conversations reflect the priorities and matters of this time. Brian, Frank, Heidi, thank you so much for joining us today for this conversation. I'd like just to start by having a bit of a conversation about what draws you to this work. Brian, maybe we can start with you. What draws you to this work and why are you working specifically in housing and homelessness?
Housing was almost a bit of an accident for me, but I have spent much of my life working with street populations. I've worked in custody with young offenders. I've been an outreach worker, harm reduction worker, worked in shelters. I wasn't necessarily looking to work in housing, but it kind of fell in front of me and I seemed to be a good fit. I'm quite passionate about the idea of building community. And one of the questions when I came to OCH was, how do you build community amongst the most vulnerable tenants? There was always a lot of tenant engagement in seniors communities and family communities. Maybe, life paths were maybe not as difficult. Parents want great things for their kids. They're willing to organize themselves. But how do you build community amongst folks who are incredibly isolated and marginalized, who have kind of suffered through systems and being the objects of systems and feel that they have no agency or power? So I think what originally drew me to the work was the idea that we could, how do you build community in a building full of really, really high need folks who haven't had great lives? And I think what keeps me there is, the tenants are amazing. I learned so much from them. They're my teachers. They keep me humble, great senses of humor, amazing life stories. And so, yeah, that's why I'm here.
Oh, that's fantastic. I love your focus on people and community. And what about you, Frank? I saw you nodding along to some of that. What draws you to this work?
I think like Brian, some of it's accidental for sure. I trained as an occupational therapist, worked with Vancouver Coastal Health for over 10 years on the sort of community treatment team, did a lot of work in the downtown east side before I transitioned to BC Housing. So very much kind of working with that same population. Always really enjoy that sort of helping role. And certainly over the years, we've seen the need for housing and sort of wraparound support services. It just increases, right? So work is there. I find it very rewarding, but I think, another thing I'd like to mention of sort of what keeps me here is also the people that I work with. I think I'm very lucky at BC Housing that we have an incredible team. We're very supportive of each other. And I think day to day that because it is hard work. And I think day to day that goes a long way into keeping us all kind of doing what we're doing.
Mm-hmm. Yeah, absolutely. Really great folks. So Brian, people who listen to this podcast are probably fairly familiar, or at least a little bit familiar with BC Housing, and maybe a bit less familiar with what you have happening in Ottawa. So can you tell us a little bit about Ottawa Community Housing and why you're out here as well, meeting with BC Housing?
Well, the second question first. I think it's important, and Heidi and I had a long conversation about just what we can all learn from each other. Our housing environments are remarkably different and remarkably similar at the same time. who we serve is quite similar, but the frameworks and the legislation and the regulations can often be quite different. So it's curious. I've got the great benefit of just being a 2-hour drive away from Montreal, so quite familiar with Quebec and how Quebec manages social housing. Ontario's got a pretty good, ONFA, the Ontario Nonprofit Housing Association, is very good at bringing people together. But I was out here, and I've been out here before, and I just thought that was an opportunity. In terms of Ottawa Community Housing, about 33,000 tenants in about 16,000 homes. We're the second largest in Ontario. I think we're the fourth largest in Canada in terms of the number of units. Like all housing providers, there's a range of tenants. Well, we have 22 seniors only buildings. We house about 9,000 children and youth, and then lots of adults. And so, our stock is average of 50 years old, getting older. Recently, we've begun to build, which is interesting, although what we're building is referred to as affordable housing, not deep affordability. So most of the programs that we're accessing right now are about building kind of what we call the missing middle, than as opposed to sort of people who have, core housing need.
Mm-hmm. Yeah, so a lot of similarities there, of course, to the work that we have underway at BC Housing. And Frank, maybe you can tell us a little bit about specifically your team here at BC Housing and the work that you do, because I do think that it's something that maybe a lot of folks wouldn't be familiar with.
Thanks. Yeah. So we're part of the Lower Mainland Shelter and Supportive Housing team. So right now, it's really kind of two main regions, right? We have what we call our Orange Hall office, which is our sort of Vancouver coastal region. And then we have the Fraser region team, right? So it covers all of the Lower Mainland. So we're responsible for delivering on shelter and supportive housing programs. So a lot of what sort of Brian's referred to, we have supportive housing sites that for BC Housing, I think most people listening to this podcast would probably know. With our supportive housing program, it is different from our Lower Mainland directly managed program, where we partner with community nonprofits to actually deliver on the operations of all the supportive housing sites. We don't do it on our own, right? So we have these wonderful opportunities to work with a variety of service providers in each of these municipalities to provide much needed supportive housing for folks that are, borrowing, Brian's term, with that core housing need. Much of our program is focused on the deep subsidy affordable housing. As well, we have our shelter programs. Again, I think what we've seen year upon year is that we're in a bit of a housing crisis here in BC. I think that's probably something we see across the country. So we are unfortunately seeing the number of people experiencing homelessness continually rising year upon year. So having those shelter resources is often a really important sort of first step to get people into housing. So we're, again, working with nonprofit partners in the community to support them to open and operate both permanent shelters and winter shelter programs.
Well, thank you for that. And I'd love to hand it over to Heidi a bit, because, of course, Heidi, you've been overseeing so much of the expansion of these programs as we scale to meet the needs of the people of BC. And maybe I can hand it to you, and you can dig into some of the specifics from here.
Thanks, Sarah. And I just want to say what a wonderful opportunity this is. Brian and I had a chance to connect before the podcast, and really what comes through, and you're hearing it as well, is his passion. In fact, he's here on vacation and spending his time learning and sharing his knowledge with BC Housing. So really appreciate that. Brian, what we're really curious about is what led to the adoption of the complex care housing strategy in 2023. What really came through to me was the vision of that, but maybe you could share with our listeners really what led to that.
So if you go back about 25 years, Ontario created the Social Housing Reform Act, which created provincial and local priorities. And what's been happening since then is an increasing number of new tenancies every year coming off lists, priority lists, which are indicative of vulnerabilities, of complex needs. The challenge is that, and I'm quite jealous the way that Frank and Heidi have been talking in terms of the ability in BC to coordinate across areas of housing which Ontario actually managed quite separately. So shelters, transitional, supportive, core need. These are all quite different in Ontario. And so, one of the things I saw right away was that we were housing large numbers of people who maybe shouldn't actually be in social housing, or they required a much higher level of support, or we really need to look at the model, because the model of independent living, and I always go back and say, Regulation 124 of the Housing Services Act says to live in social housing in Ontario, you have to be able to live independently with or without supports. And yet there's no provision for assessing that and deciding where's the best place to put people. So, for example, in Ottawa, we house a very large percentage of the waiting list for supportive housing in social housing. They may have supports, but the supports are quite limited, or they may have no supports at all. And so the real challenge with housing people who are coming out of chronic homelessness, living with mental health or substance use issues in an independent living environment. And so really kind of thinking that, it is creating challenges. And I think I talked earlier about, I've been generating data from the health system and emergency services internally for the last couple of years. And just the cost to the system of our buildings, which house a lot of high need folks, is incredibly high. So just one thing, in 2022, I looked at 15 buildings, which have about 12% of our tenants. Those buildings have about 3,900 tenants. 37% of them visit an emergency room in 2022. And of those 37%, 40% of them went for a mental health, substance use, or behavioral issue as a primary or secondary diagnosis. High police calls for service, high fire calls for service. Same with paramedics. And then you add to that the cost to the landlord in terms of insurance costs, hoarding, pest issues, security calls for services, elevator maintenance. They are remarkably more expensive to operate, which is indicative of the fact that we're housing people who have a lot of challenges living independently. And often those challenges is that they're easily victimized. And so, when you operate a housing portfolio of independent living, but people are very vulnerable, they're often at risk of being victimized from people outside the community. But we're simply not resourced to provide the kind of supports and on-site presence that a supportive housing provider would have, for example. So, it's just some real challenges that have not only recognized when I started the OCH, but I saw were growing year after year.
And it was really so impressive to hear the data-informed approach, the information you were able to take to the municipality and government partners to really indicate the need and address that gap. But again, was just really impressed by what we heard for Ottawa Housing in terms of sharing data and informing gaps using that data.
As I mentioned to you earlier, gathering that data has been hard work and complicated. And I think really the way forward is, we're beginning to have a discussion with some of our partners in order to say, look, let's all agree that every year we are going to pull this data. Because once it's written into a program, you can add as many postal codes as you want and you can pull it. But right now it's sort of going and asking, please give it to us. And then 2 years later you go back and that person is gone. So you have to educate somebody new and they might give you something slightly different. So I think, we really need to kind of figure out how to get regular data pulls from emergency services, the health system, but also internally. What data are we collecting so that we can, one of the things about higher buildings or communities with lots of higher need folks is, what is our service model? I think there's been a tendency in social housing to sort of look at every community as being the same as every other community. And we have a service model, which is we kind of spread with a butter knife. And we really need to think differently. And I know, for example, Toronto Community Housing is going through a process of trying to categorize their buildings into 3 levels. Okay, that's fascinating. Once you end up with those 3 buckets of different communities, the next step would be say, okay, what service level should we be providing in them? So, do you need to send security on a regular basis to a community where there are no security issues? Some communities are going to have more wear and tear. So, what is the maintenance budget for this community versus that community? So I think there's some really interesting things that can come out of that.
That's wonderful and so inspiring for BC Housing to be able to work through that. Frank, you've done some amazing work in encampments, both in the Lower Mainland, and shared your expertise on the island as well. How do you approach building trust and rapport with the vulnerable population we serve there and support? There's such a variety there, but I know you've been very generous in sharing your knowledge and expertise with our regional teams.
Yeah, no, I don't think there's a magic bullet there. I think it's important for us to sort of recognize again that everybody's story is different. You know, how they sort of ended up experiencing homelessness is going to be very different. So really for our team, it really is just putting in the time. It's sort of as simple as that, but it is a lot of work to just spend time to be with people, to listen to their stories, right? I know a lot of it is kind of cliche things, but they're true, right? We don't want to be judgmental. We want to be very client-centered. We want to be trauma-informed, right? But it is actually a really big and real part of the work. And just recognizing that folks that are living rough outdoors, you know, there's likely going to be a history of trauma there. So really, it's being there for folks, being patient, listening to folks, and being really transparent and accountable for what we say and what we do. We don't want to overpromise. We tell folks the way it is. We try to sort of accommodate people's needs as much as possible, but at the same time be realistic around what resources are available. And again, really appreciate what Brian has said about the experience in Ontario. Every community is different. And I think in terms of encampments, we're going to find that every community is going to have a different set of resources, right? And we don't want to be setting up false expectations for folks. And I think it really is just kind of taking that time to work with the individual clients that we're coming across. It is very much a team effort. Ultimately, we need to have some resources to offer folks. And that's where, you know, our team is working quite closely with our other teams like development services and with our supportive housing advisors, right? Because we're using, you know, whatever tools we have available to try to accommodate people's needs, right? It's not easy. I don't think we've got sort of the magic bullet or the right answer yet. Again, we're seeing that encampments are becoming quite common across British Columbia. But I think that more speaks to sort of that growing kind of gap between affordability and what people's incomes are. It's a bit more complex than that, but I think that's probably sort of umbrella reason of why people are losing their homes, right?
I was just going to add a comment. I found it very interesting when Brian and I connected that Ottawa isn't seeing the encampments, large encampments that we are. You know, the very small encampments we were talking about. Is it the weather? But, you know, I'm thinking about the work that you do, you and your team do every day, Frank, and how that's a big part of the work. But again, it's the regional differences and the fact that one solution doesn't fit all. And we're making sure as a part of our supportive housing is cultural supports, you know, Indigenous supports, elder supports. Just wondering if that's a part of the model in Ottawa as you look at the complex care housing model.
Not yet. I mean, we are still kind of fleshing out what it would look like. Certainly some of the early operationalization of complex care housing is looking to our partners to sort of provide that cultural competence and support that we might not necessarily have. So we also look to our partners in terms of case management, whether they should be, you know, they're providing that. We house an incredibly diverse population, particularly in our family communities. And so we're always kind of considering how better we can support them. One really interesting journey for us has been the diversification of our staff. And certainly in my time at OCH, it has become an incredibly diverse place as an employer. Multiple languages on staff, as varied as our tenancies are. I think it's also been really important for us to say things when we're looking for new employees that experience living in social housing is seen as something of value to us. So that lived experience of, whether on our board or our staff of having grown up at OCH or any other housing provider, it really provides a lens that, someone like myself wouldn't have. So that's one way we're looking at that.
Boy, again, very inspirational. And it just speaks to how we can do our work very effectively, but in different ways.
Heidi, can you, just to help set the context for our conversation, can you help explain a little bit about what we're talking about when we use the term complex care? What does that mean for housers anyway?
Well, it's definitely a program that we've been looking forward to for some time. I will highlight that it looks very different. We really do honor what the needs are in the community. Complex care housing is really the step above supportive housing to be able to ensure that people whose needs aren't being met in supportive housing can get their needs met. It may be the cultural supports they need, home and community care, complex care housing. There's a range of supports that may be in the building, and it may be clinicians, it may be mental health and addictions workers, doctors may visit the site. But really, again, it's about the community, our regional health authorities identifying with BC Housing what are the needs, who are the people that aren't having their support needs met, and ensuring those enhanced health services are there. Those are above the meal program, the tenant support workers that are there 24/7, those on-site care. They're additional. So it's really important to highlight that complex care housing isn't transitional. It can be somebody's forever home. So if they need those supports for the rest of their life, they're welcome to stay there. But the workers are going to work with them and make sure that their needs are met. What we're hearing is that our health authority partners may reduce the support needs just based on what is happening in those folks' lives at that particular time. So again, just really excited about complex care for the fact that we know those enhanced health services are important for preservation of housing and continuity of housing, but better support people to be the best they can be.
Frank, when you think about the work that you do in community to help connect people with housing services that meet their needs, how does complex care housing play into that? What types of clients do you find are best supported? Are you finding that it's an important tool to have in your toolbox when you're out there speaking with folks and helping connect them with services?
Yeah, I think complex care has been great. It's something we've had feedback on for many, many years with our supportive housing. Again, our standards sort of staffing motto for a supportive housing site is staff on site 24/7, but usually 2 or 3 staff on site. And these are a nonprofit staff, so they're not clinical staff. The nonprofits do a fantastic job around sort of those non-clinical supports. I think complex care has been great coming in to really address that gap. So now when folks are living in supportive housing, if they do have care needs that are a little bit beyond what the nonprofit can provide, because maybe they need wound care, maybe they need medication management, whatever the case might be. We have now this complex care team in partnership with the local health authorities who can kind of provide those. And like Heidi says, keep people successfully housed, right? So we're not losing people through that gap. It really is, I think, a really important part of that housing continuum because now we have folks that are in supportive housing who in the past may have lost their housing because of this lack of these complex care clinical supports. But now they're able to stay there. And again, over time, if it's a physical health issue, they're getting the support they need. They may not need that forever. And then that resource could be freed up for someone else. So it's been really, really good.
We always need more tools and options for people, especially as we look at a housing first model and having a complete housing system.
Just as a successful authority, and of course we won't mention any names. So about last year or so, prior to complex care rolling out in the Lower Mainland, we would often have applicants that we're working with in the community who would be very difficult to remain housed. And I can think of several individuals who have been repeatedly housed and have lost housing. since complex care has been available and they've been able to sort of get supports from that program, they've been able to remain housed. So that's been a real, I think, real world example of how this has been really helpful for some folks.
Yeah, that's all the difference, right? Yeah, for people to be able to maintain that housing is so crucial. Brian, you're heading back. This is your vacation time. You're spending out talking about housing. That says something. But you're going to be heading back to Ottawa soon. What's the one thing what's the top thing that you're going to bring back with you in terms of what you've learned from your time here in BC?
So I'm going to back up a little bit. It's just interesting how we're both using complex care to get to the same place, but it's to fit in a very different part. So for you, complex care is something beyond supportive housing. In Ontario, supportive housing is the ultimate in terms of wraparound 24/7 supports. For us, complex care is to fill the gap between independent social housing living and supportive housing, in large part because we are housing lots of people who are eligible for supportive housing, but are on a waiting list, or are not ready or not able or not eligible, but need something more than the independent living model that we're funded for. So for us, it's almost like it's a place between 24/7 supports and what we have right now, and trying to figure out exactly what, and of course that can mean many different things. In terms of going back to Ontario, I mean, I think one of the things that's really interesting listening to you is that you have oversight of a range of options in housing that we do not. We are simply core need housing, and we have a new growing affordable housing. So, mid-market, people paying 70% of market rent as opposed to 30% of income. But we're not really moving into the area of more supports. And complex care is about trying to solve that. And whether we do it or we're just looking for different relationships with partners, whether we're building new or we're converting existing buildings into more of a supportive model or structured model, these are all things that that we're looking at. A very exciting thing we're working on right now. We're looking at turning over a portion of one of our rooming houses to a treatment facility. Why would you do that? Well, the tenants already live there. So it's not like we're inviting in a whole new population. These are people who do live with us, but don't have access to treatment. And the goal is, as opposed to taking that person in need of treatment directly from the streets and putting them in independent living, if they could run through a program and come out the other side much more capable of being successful in their housing and sustainable in their housing. These are the sorts of relationships and the types of layers and steps that we want to create. Because I think, we've got this type of, we've got supportive housing, we've got transitional, we got social housing, but people's housing need changes over their lives. And we want to move everyone towards higher and higher levels of independence, of agency. And by having different options, and whether it's you're in a different building or we're just able to move or, add or reduce supports in the same building. For me, complex care housing is anything that takes someone who has challenges living independently. And that could be someone coming from the street, but it could also be a senior who is getting close to, not being able to live independently, and just helping them live with dignity and independence just a little bit longer. It's a win for that tenant, but it's also a win for the health system. It's a win for emergency services. It's a win for us. So anything that kind of helps that person live just a little bit longer, a little more independently, a little more with dignity, to be successful, to me falls inside the bucket of complex care housing.
I think it's so interesting that our jargon is different, but we're all kind of trying to do the same thing, right? So the province recently rolled out what we call the supported rent supplement program, which sounds a lot like what Ontario is calling complex care. So this is again a partnership with our local health authorities as well as Ministry of Social Development and Poverty Reduction. So I don't know what you call that in Ontario, basically the welfare office, right?
Ministry of Community and Social Services.
Yeah, okay, thank you. Yeah. So the supported rent supplement program is really our piece of that continuum, right? That you're referring to as complex care in Ontario. Sounds very similar. Well, that's
interesting. And probably this speaks to your role as a provincial agency and your connections to other ministries. I mean, we are a local housing corporation. We are a wholly owned corporation, nonprofit housing corporation of the City of Ottawa. that came to Ottawa through downloading of housing services back in the late 90s. Probably the work that we're doing right now is an attempt to be more operational, although at the same time, we're also talking, we're advocating at a provincial and municipal level that, we're trying to fix something, but this is not just Ottawa's problem alone. Any large housing provider in Ontario, in Canada, has the same issues. And although there are things that we can be innovative about, there are some things the province can play a role in changing. I've known for a long time, because I was out here a while ago, visiting some local housing organizations in Vancouver, that you have quite a close relationship with the health system. And we have great health partners. But I think the fact in BC, there seems to be a direction from on high that housing and health work together. And that's something that we're trying to work on at a local level, but having that provincial blessing probably is helpful.
And the Belonging in BC program really speaks to that integration and coordination. And that's foundational for complex care. Frank, you'll find it interesting. There's no assessments for housing. So we talked about our coordinated access system and the VAT, and just some of the differences that we see here, and probably a lot more silos between the housing, because we talked about the SRSP rent supplements and how they're at the coordinated access table, so we can create that positive flow. So learning from each other. I'm coming
back out to take a good look at your coordinated access.
Mm-hmm. Oh, this has been such a great conversation. I mean, Brian, I think sometimes in BC we have a tendency to really take for granted some parts of our system here. What would you leave our BC listeners with in terms of your perspective on what you've seen here, and what you think others could be learning from?
I think there's just some real core components of coordination that exist here and have existed here for a while. And I realize they haven't always been funded the way that you may have wanted them to, or, they change with governments. But, for a long time, I've known of the relationship in Vancouver, particularly between BC Housing and the health system. So that's something that's really, that's something valuable and something, that we're trying to develop, and we probably could learn from you about that. I also recognize, going back to the fact that you are a provincial organization, there's kind of more opportunities at a provincial level to help nurture those types of relationships.
Yeah, that's absolutely true. Thank you so much for making time to come out here, Brian. And thank you so much, Frank, for joining us, and Heidi for helping host today's session. Let's talk again soon. To learn more about BC Housing, including how to apply for subsidized housing in British Columbia, visit bchousing.org. You can also find us on Facebook, Instagram, LinkedIn, and X. If you enjoyed this episode, give us a rating. This will help others find Let's Talk Housing and join the conversation. You can subscribe to Let's Talk Housing on Apple, Spotify, or wherever you listen to your podcasts.